Hello, hello, and welcome to today's episode of Talking All Things Cardiopulm. I am your host, Dr. Rachele Burriesci. Before we jump into today's episode, I'd like to read a message from our sponsor, Jane. Many of you are familiar with the name, but if it's new to you, Jane is a HIPAA-compliant all-in-one practice management software and the sponsor of our show today. The team at Jane knows your time is valuable, and they've designed online intake forms to help you reduce admin work and so that you can take back your treatment time. Whether you need to collect patient or client data, insurance policy information, health history, or consents, Jane's online intake forms offer a safe and secure way to gather everything you need before your patient walks through the door. You can also collect payment details securely through your intake form via Jane's PCI-compliant payment solution, saving your patient's time at checkout. To learn more about how Jane's intake forms can help, head to jane.app/guide or book a one-on-one demo with a member of their team. If you are ready to get started, you can use the code Cardiopulm1MO at the time of sign up to get 1 month grace period applied to your new account. Thanks again, Jane. All right, so today we are going to talk a little bit about my story with POTS. So this is Dysautonomic Awareness Month. It's also Physical Therapy Awareness Month. And so today we're going to talk about a PT with a dysautonomic problem. So I'll give a little background information and then kind of dive a little bit into POTS. I'm not going to go too deep into pathophys, but who knows? It's me. I really might. So I was a resident in a residency for a year. And then after my residency, I was hired in as a mentor. And so in that time, I had lots of different stressors in my life. I had recently moved across the country. I had some personal things going on, and I was in a year-long residency. So if anyone knows anything about a residency, you are all in for a year. An 8-hour workday is nonsense. I think there were some days we were probably in the actual office from, I don't know, 7 a.m. to 7, 8, 9 p.m. And then when we get home after eating some dinner, we would be studying or videoing or whatever. So it was an intense year. I mean, that's fact. I knew what I signed myself up for. And then when I went into mentoring, I was still a part of that life. So it was a different type of stress, but it was still very much go, go, go. So I think part of that is important to kind of have as a baseline information because it might have played into this next piece. So I sat for my CCS in March and had been studying up until that point, was teaching in the residency, had a few days off here and there to like purposely study. I definitely study different as an adult learner and do even more to this day. But it's still a good amount of time. It's a lot of focus. I was probably drinking more coffee than I normally do. Just giving like some background potential things that could have been going on. But when I sat for my exam, I must have been like 30 minutes in, maybe an hour in, and I did not feel right. I was kind of tunnel vision, saw black for a second, had that feeling of like the blood rushing to your feet. And I had that moment of holding on to the chair thinking, holy shit, what is happening? Am I good? Am I good? Like talking myself out of whatever was happening. You don't have water at the table. So I was having the like internal, should I get up and take a break and go get some water? But I sat there for a second, I breathed, and I was okay. So I continued with my board exam test. Not a lot of people know that story, but yeah, I totally blacked out on my exam and had that moment of, holy shit, am I going to pass out right now? I didn't pass out. And after the test, I was fine. I had no residual anything, kind of went on with the day. That weekend, I think we went out to dinner. We did go to like a beer fest, which is a big thing in Michigan where do some beer tasting, but nothing crazy. I'm like an old lady when it comes to that kind of stuff. I enjoy my beer, but, like, no one's going crazy over here. And then I think it was like 2 or 3 days later, I was at work and I was actually going up to the ICU. I don't know if I was going up to ICU rounds or just to see a patient, um, but I always took the stairs. So our office was, let's say, on the second floor, and the ICU was like on the fourth floor. So I would take 2 to 3 flights of stairs up and just go do my thing. Well, when I was walking from the PT department to the ICU, I was in a hallway by myself, and mid stride, really had this sensation of I'm going to pass out. I had that same feeling of like the blood rushing to my feet. My heart was pounding, kind of had tunnel vision. And same thing. I was like, holy shit, do not pass out. Like, literally, who is finding me in this back hallway right now? And so I don't really remember how I got back to the office. I was still on my feet. And I remember holding on to the handrail because there was like handrails through the whole hallway. And I got back to my office, which was the residency office, and, there was, like, 2 residents and another mentor in the room, and I was like, "Something is wrong, I'm not right," and literally just laid on the floor. I was pale, I had no color in my face, no color in my lips. They got a blood pressure on me, they did, a quick EKG, but the noise on the machine was too great to really tell, but it was definitely not normal sinus rhythm, but we couldn't tell exactly what it was. And I honestly had no part in looking at it because I did not want to um, amp myself up even more about whatever was going on. So they called. Um, Nikki at the time was my girlfriend, so they called her, and she was at the hospital next door where I had to go, um, because I could not go into the VA because I'm not a veteran. So, um, I drank water. They got me in a wheelchair, and either Nikki came to get me or a colleague took me over to the emergency room. And, there was like no urgency in the emergency room. I did not pass out. I was still coherent. I was ANO times 4. But my heart was still racing out of my chest. I had palpitations. I just didn't feel right. And I think the statement that I probably said the most is I feel off. Something's not right. Um, so they bring me in. I must have told the story to about 20 different people, multiple residents, maybe one attending, medical student, nurse, all of the people. Um, what was most interesting about that experience was not just the scariness of the episode. Like, there was a moment where I was like, holy shit, what's wrong with me? And, I'm a cardiopulm almost specialist at this point. I live and breathe this stuff. I'm in it all day. I'm like going through the laundry list of things that could be wrong, which does not help, right? And then being in the emergency room was just such an interesting experience, and it was a little upsetting to me more than anything. So at the time, I was probably 25, 26 years old. Actually, that's a lie. I was 27. Um, Relatively fit, not in the best shape of my life, honestly. I just came out of a residency, like, let's be completely honest here. Um, and I'm in scrubs, right? Like, I don't know, when you have a picture in front of you, it sometimes helps, and then it was just really a confusing situation for me. So, I had a lot of random questions asked at me that didn't really pertain to the things that I was feeling or dealing with. So, my heart rate was very high. On ECG, apparently I was in, sinus rhythm. Um, no aberrant beats, no ectopic foci, so okay. But my heart rate was very high, and I felt worse upright than laying down. When I lay down, I kinda calmed down. But they started asking me questions. So it was the day after, It was the day after St. Patty's Day. And so the first question they asked me was, "How much did you drink last night?" And I was like, "Well, actually, I didn't drink at all because I went to bed early. I was like exhausted, right? Like I had just come out of taking a CCS exam. And then it was like a Monday or a Tuesday. I work. That wasn't out drinking. So I don't know. The first question kind of took me a little bit off beat. And then they started asking me about my diet. And they're like, "Are you on any strange diets?" And I was like, "No, what do you mean by strange? Like I eat relatively healthy. I eat 3 meals a day. I don't miss meals. Um well-balanced diet. Like this is the stuff that I teach every day." Um and they were like, "Well, do you eat ice chips?" And I was like, "Do I eat them? No, like I put ice in my drinks." And they're like, "Well, are you on any sort of like weird diets where you just eat baking soda?" And I was like, "What? No, people do that?" And that was really the like I don't know, it was very frustrating. It there was less questions about like my past medical history or the events leading up to the day, and more about like these odd things that could be causing whatever was going on. And so I was starting to feel like not under attack, but not supported. Maybe is a good way to put that. And I just remember sitting there, and I think Nikki was finally with me at that point. I was like, "What is happening?" And she's like, "I have no idea." So they asked me about eating baking soda. They asked me about eating ice chips. They asked me how much I had drank last night. And I'm not trying to sit here and say like I don't ever drink. You know I drink. I enjoy craft beer, but that's like a different thing, right? Like I'm tasting beer. I like a beer. We're not getting hammered on St. Patty's Day. Also, I'm in scrubs. Like I legitimately am in scrubs. Have my ID badge still on. I might even have a freaking stethoscope around my neck at this point. But it was just a very interesting experience. So allegedly my labs were fine, my ECG was fine. No one could explain why my heart rate was high. Um, and I was already starting to feel better, but I also had been flat, right? So like I was laying down. So they made me walk around a few times and I was a little off, and that's what I said, like, "I feel off, I don't feel right." But I wasn't profoundly dizzy, I wasn't passing out. So I asked about, like, having a telemonitor or, some way of just, monitoring heart rate while I was discharging, and they didn't feel it was appropriate at the time, and I really wasn't in the emergency room that long. So I left, we left, had a normal dinner, just didn't feel right. Like I still to this day don't know if I can describe all of the things. I can tell you a lot of different things, and I am not an expert on POTS, but I probably know more than most. And having ha- had it, I understand the weirdness of it. Um, So I was just off, and I was off for about 2 days. I went to work the next day. I was able to take it a little bit lighter. I had flexibility in that job, which was wonderful, but I just was a little bit not right. I think it was 2 or 3 days later, we went to bed and I felt really not right. And I remember like staying up thinking, should I wake her up? Should we go to the hospital? Am I having like am I having a heart attack? And I was in bed and my heart was beating out of my chest, and my biggest symptom besides feeling lightheaded and like feeling my heart racing was and occasionally still is bounding in my ears. So I could hear my heartbeat as if my heart was in my ears. And so That's just, like, super stressful to hear it, and I could hear that it was fast, and I could hear that it was irregular, and I was having some, like, weird, temperature regulation things, like, I was cold, I was hot, my left arm sort of felt cold. I had a lot of palpitations. I was feeling chest pain, and I was feeling chest pain specifically at my PMI, point of maximal impulse, which is basically fourth intercostal space, midclavicular line. So not mid sternum. It was sharp. It was like at where the apex of the heart would be located. And it felt worse if I laid on my left side. And that makes sense to some degree because when you lay on your left side, your heart hits against your chest wall more. I could tell my heart rate was fast. Um, Nothing really was relieving it, even being in supine, I actually didn't like it at some points. Um, and I think it was probably 5 AM. I finally woke Nikki up. I was like, "We have to go to the emergency room. Something's really wrong." So she took me, and they were a little bit more urgent the second time because I had been back in 2 days and I was actively having chest pain. Still had not passed out, still felt really off. I could feel my heart racing. I could feel my heart in my ears. Um, it was wild. I mean, I don't even know how else to describe that. So, second round in the emergency room really wasn't much better of an experience for me. They asked me less questions about eating baking soda, which I was thankful for, but then they were really harping on anxiety and stress. And I'm like, I'm really not an anxious person at base. And although I have had a lot of stress in my life, personal and professional, I sort of just ended that stress, right? Like I just had this big episode of stress relief. And so that kind of plays into a conversation we'll have a little bit later, but I wasn't feeling anxious the moment before I almost passed out walking to the ICU. I was in my regular routine. I was mid stride. I was like doing my thing. And that episode happened. Um, could I say I was anxious in that moment? Hell frickin' yes. Like, there is no way that you can feel your heart pounding in your ears and not feel anxious and then not feel stressful. Um, but then they really started harping on like stress, anxiety, depression, and still kind of was ignoring the whole my heart is like at 130 beats per minute and I don't really give a shit if it's saying sinus rhythm, something is wrong. And so what was really interesting, and I started paying attention at that point because I was getting really frustrated. So I was in flat supine. I had a pulse ox on. They never actually put me on telly. They did an ECG, but they didn't put me on telly. So I wasn't being monitored in the moment that I was there. I was just given an ECG, like a 12 lead, right? And so I say just, but there's a point to that. When I had my pulse ox on, I could see my heart rate. And if I sat up, or like the head of the bed was raised, or I like literally went into long sit, my heart rate would increase. I mean, something crazy like 40, 50 beats. My blood pressure normally is a little bit on the lower side, like forever. I usually run somewhere between, actually, before POTS, I probably ran 100 to 110 over 70s, maybe over 60s. But at that time, I was running anywhere between like 80 to 100 over 60s. Um, so I was hypotensive. And I felt like that. Like I felt like I'm not passing out, but I feel like there's potential that it could happen. But the palpitations were really stressful. The chest pain was like I was starting to get really concerned. And the heart rate increasing just with my head of bed being raised. And so in that episode, one of I think he was a resident. He came in and they kept taking the pulse ox off me. So they actually put an IV in the second time And I was happy because I was like, well, maybe I'm dehydrated. Like maybe my labs are not abnormal, but maybe I'm on the low end of something. Like maybe fluid would help. And they were just having me like drink fluid, like water, which I was doing, right? Because that's what you're telling me to do. But I still to this day wonder why they didn't give me an IV. They literally put the IV in, but they never attached me to a bag of IV. So once the ECG came back fine, they were like, "You're fine. You're young, you're healthy. Obviously, you're just stressed out." And so I go, "But do you see what's happening to my heart rate? Like, I'm flat and I'm like running almost Brady, right? Like, I think the lowest I was seeing was 48 and like averaging somewhere around like 55. But when my head of the bed went up, my heart rate was like 120. And the resident tried to explain to me that when your head is elevated, your heart has to beat faster to squeeze the blood to your brain. And at that moment, I looked Nikki in the face and I, excuse me, I'm like cursing a lot of times. Get me the fuck out of here. That was my immediate reaction. So again, I asked if they would give me heart rate monitor because they're like, maybe you're having episodes of SVT. Yeah, great. Maybe I am. Can we put me on a halter? And so then I didn't have a PCP established yet in Michigan. So because I didn't have a PCP, they refused to give me a halter. They didn't really think I needed to go see a cardiologist. They really didn't give me any advice on like what to do. Basically, if you feel like this again, come back to the emergency room. I didn't have any ST changes noted on ECG, but I did have a T wave inversion the second time I came. And I was like, does anyone want to care about that? Because I certainly do. They did not run troponins on me. They ran normal lab values. They ran urine analysis. And that was about it. They were like, you're young, you're healthy, and clearly you just are stressed out. And I was like, okay, I need to go find somebody else who's going to listen to me. And so I think that was the most frustrating experience for a whole bunch of reasons. One, because I am educated. I am a cardiopulmonary specialist. I am in scrubs, and I was being spoken to as if I was like purposely not eating well or trying to diet in an inappropriate kind of way. I felt like stress and anxiety was the only piece of this puzzle. Like obviously you're just stressed out. I didn't feel listened to, and my heart rate was like a freaking concern. And there was really no answer to what was happening. And that was really freaking scary. It was so scary. And so if you want to ask me if I had anxiety in that moment, yes, I did. I was super anxious. I was like, holy shit, am I going to have a heart attack in the middle of the night? And like everyone just ignored me. I actually went to work a few days because I was afraid something was going to happen when I was by myself. And I figured at least I would be around people who knew what to do if something went wrong. I think the day after that, or actually that day, right? Because we went at 5 a.m., I called out. And I decided to call a cardiologist that I worked with at the VA. And I was like, I'm freaking out. This is what's happening. No one has any answers for me. They're making me feel like I'm crazy, like I'm seeking this. And yes, I have a lot of stress in my life. And yes, I typically handle stress differently than other people in the sense that I don't typically like get stressed and then take it out on people around me. I do internalize stress, and I'm sure that has taken a toll on my health in different points in my life. But something is wrong and nobody's listening. And the place that I'm supposed to get that help, I'm being asked if I'm eating baking soda. Um, Eating disorders can really cause lots of different issues, and I'm sure it could create problems with heart rate palpitations. I know this, um, but there's also the point where when you ask somebody about their diet and you tell them that you eat 3 balanced meals a day, and it's still not like accepted. I don't know. That was a little bit. It was off-putting for me. It was frustrating. Um, but it was really difficult. So I was super glad that the person who I reached out to, she was actually a cardiologist at the VA and for private sector, and she specialized in women's cardiology in the private sector. Um, and she was like, "You're okay. We'll get you in the office tomorrow. I think this is what it is. I think this is POTS." And I was like, "What is that?" And so now I'm almost a CCS at this point, and I had no idea what POTS was. And that's typically the response, even when I give it in my past medical history. Not a lot of people um, know what POTS is. I think it's getting more prevalent with COVID because POTS is a potential outcome of long COVID. It's more in the forefront. It's more spoken about. The research is improving, but there's still a lot of unknowns. So I went to the cardiologist and she did 2 ECGs, kind of back to back, and she did it with me in supine and she did it with me in standing. And she's like, "Yep, I mean, like you fit the definition." So she's like, "This is what we're going to do. There's medications that you can take. This is what they are. One of them, fludrocortisone, is the one I would like to put you on. This is how it works. It increases your intravascular volume, helps you retain salt and water, and basically you stop taking it when you start having excess swelling." And I was like, "What? I mean, that sounds like you're putting me like in a right side heart failure situation just to get my blood pressure up." Or she's like, "Yeah, I mean, essentially that's what you're doing." She's like, "It's not failure, but you are essentially provoking improvement in your intravascular volume by retaining salt and water." I was like, "Okay, what's option 2?" She's like, "Option 2 is you increase your fluid intake and your salt." And I was like, "Okay, great. Let's try that." And so my next question's like, "How much do I drink? How much salt do I need to take in?" She's like, more than what you're doing now." So I really didn't have a ton of guidance on what that meant. She told me to eat more salty foods. Like my cardiologist literally told me to eat a bag of chips. So I started looking at high salt content foods like Campbell's soup, like all the things I tell my cardiac rehab patients to stay away from. I'm like going to the grocery store and we're stocking up on tomato soup because it's high in sodium. Fun fact for people who do run cardiac rehab or deal with patients with heart failure, V8 is very high in salt. A lot of patients drink it because they think it's healthy, right? The label says 8 to 12 servings of fruits and vegetables, depending on what kind you get. What they don't tell you is, well, they do if you look at the label, but it's a ton of salt. And even their low sodium version is pretty high. So I wasn't offered a salt tablet. Those do exist. And the things like LMNT or liquid IV really did not. I don't even say they didn't exist. I personally didn't know about them. And social media wasn't really in the place where you would see a company like LMNT, to purchase electrolyte packets. Coconut water was the other thing I was told. But for any of you that drink coconut water, you know, that's wonderful. I can't drink it. I think it tastes like dirty water. I tried so many times. I tried to take it in a shot version. I just tried to hold my nose and go, and I just never could do it. I truly couldn't do it. But I started drinking more water. I started adding more salt, and I did feel a little better. I also got compression socks, and I was starting to at least feel like I could function. I was upright. My heart rate response was still super weird, but I could do things, right? Like every time I stood up, I wasn't passing out. So I started using all the things that I knew, right? Like I would do a quick set of long arc quads, hip flexion, ankle pumps before standing up. I would wait at the edge of the bed before I stood up really quickly. Like I was doing all the things we teach our patients with orthostatic hypotension. Now, to be clear, I was not let me say that again. I did not have orthostatic hypotension. I was hypotensive, and I had orthostatic tachycardia, and that is textbook POTS. Definition of POTS is an increase in heart rate at least greater than 30 beats per minute from supine to stand within 10 minutes of time. I was hitting that in seconds, not 10 minutes. And the symptoms matched a description, and I was not orthostatic hypotensive as well, because that could lead to different diagnoses. So looking at those definitions, it fits. I still had that feeling of, and I was very upfront with her, the cardiologist, because we were colleagues. And I was like, can you please do an echo? She's like, there's really no reason to. I'm like, okay, can we at least talk it out? She's like, let's do it. I'm like, okay, reasons to do an echo. Check valves. Okay, no murmur. Okay, so valves are out. Check EF. I don't have concern about your EF. I still really wish I did an echo. I think I would have fought a little harder if I don't know how to word this. I wish I would have fought a little harder as a just in case, but I felt comfortable because this was someone I trusted, and it was someone who actually was listening and had an answer. ECG showed no ST elevation depression. She also was not super concerned with the T wave inversion. I still was. So we kind of talked through a whole bunch of things. She's in stress test. She's like, stress test typically isn't super accurate for women anyway, so I don't think it's worth doing. And so we kind of just walked through the reasons. And same thing, I was like, what about running some troponin? She's like, you don't have an ST change, so at least we can like go back and forth. And we were having dialogue, right? We were having a professional dialogue, and I appreciated that. The one thing I do wish is the echo. A TTE would have been non-invasive, not expensive, and I think it would have given me a little bit more peace of mind. But, I took the advice and I did the things. And so I slowly was improving. My symptoms did last some time. They got better when I started adding those 3 things. So water, salt, compression were really big. I had the medication available. I never actually took it. I didn't like the option. I knew if I got worse, I would maybe have to consider it, but it really wasn't in my cards, I did not want to do that. I had lots of other questions like, how is POTS going to affect me in the long term? Is this going to cause any sort of heart dysfunction or arrhythmias later on? The answer is I don't know. And I actually purposely did not dive into the literature because of the dialogue of stress and anxiety, and that could be feeding into symptoms. So I allowed the physician to make the call, and I followed the advice. I do truly wish I would have asked for a salt tablet. I wish I would have known about like any sort of electrolyte packet. So I was starting to eat a lot of salty foods, and I was feeling better, but then I was also gaining weight, and I was a little bit more like swollen feeling. And I'm like, okay, well, this is kind of counterproductive, right? Like I'm gaining weight, not in a good way because I'm eating junk. I need to kind of figure out how to get the salt and the fluid and start to exercise, because exercise was also on the recommendation list, resistance training specifically. For the first few weeks, I really did not feel well enough to do it. If I could do it over again, I would probably start the same week and I would know how to handle it, right? Like it's after the fact that I've learned some things that I probably could have done better. But I truly didn't have much guidance. And I'm super thankful that this cardiologist even had an answer, right? Like she made me feel like I was not crazy. So the two things that she did say, she's like, POTS most common in women in their 20s. Research supports that. It actually says anywhere between 16 and like 28. Research also says that typically it happens to young women in new careers and can be super detrimental to like progressing in their career because it can literally take them out, right? Like if I didn't work with the people who I worked with who had eyes on me, who were like, hey, don't overdo it, I would be in a different situation. There are people who can't maintain upright position. And like, how are you going to go to work if you can't stand up or drive or, whatever? So lots of different things attached to it. The other piece, besides stress as being a possible cause, is post-viral syndrome. So that was one question that they did ask me in the emergency room. They said, have you recently been sick? And I was like, no, actually, I haven't. So I usually get like strep every year, like January, February time. I lose my voice almost every year. This year, that year I had POTS, did not get sick. So I had no known virus. I had no known sickness. That's like the one thing that really truly can cause POTS, which is also why it's so common post-COVID. It's post-viral component. So I still don't 100% know what caused it. It could have been just the sympathetic drive. And that's the more I'm diving into some of the pathophys, my guess is the autonomic system was hard pressed in sympathetic mode for over 2 years. And either right at the time I took the test, the parasympathetics try to put on the brakes, and maybe, we just like, we went too fast, we went too slow. And I think there's definite autonomic component to it. The non-pharmacologic interventions that were given to me are still the primary treatment for patients with POTS. So I just started kind of getting into a routine. I would drink 3 bottles of water in the morning, 3 bottles of water in the afternoon during my workday, with 1 Gatorade in the morning and 1 in the afternoon. And then I would still have some like at home, like another 1 to 2 bottles of water. I had my like schedule. So for people who see that I usually drink bottles of water, this is actually part of why I typically do. It was an easy way for me to calculate. And yes, I know I could do it different ways, but it was still the easiest. I also find that certain water doesn't make me feel hydrated. It's a weird thing. I don't know. When I drink tap water in the East Coast, I feel hydrated. When I drink tap water here in Kansas, I feel thirsty. Like I could drink water all day from the tap and I am thirsty. So I typically drink bottled water. But I had my routine and then I was doing pretty good. I was back to exercise. And every now and again, I would start to become symptomatic again. Like I would have different things that, like, maybe if I wasn't sleeping well, or again, like if I had a lot of deadlines to hit, or if I did drink, I honestly, if you ever see me have a beer, I always have a water with me. I typically don't go without. I was very attached to water, and I couldn't miss my dosing because if I did, I just didn't feel right. And if I got behind, um, I started to tell very quickly. It wasn't like days and weeks, it was like a day. Like if I missed a bottle of water, right? Like whatever it was in my dosing. And I wore compression socks pretty much for like 2 to 3 years straight. And that seemed to make a big difference. Now there are a few medications available to treat POTS. We have fludrocortisone, we have midodrine. Those are the two most common. There are some other possibilities, like there's talk of using beta blocker to help decrease the beta 1 sympathetic input. I'm telling you, if you would have given me a beta blocker at that time, I'd be down. There'd be no way. There is some research that suggests maybe IVIG is going to be potentially used in those episodes. There's also research that like a bolus IV can be very beneficial. So I, to this day, still wonder if somebody would have given me a bag of fluid in the emergency room, if my symptoms would have improved more quickly versus like having to wait out the time to catch up with salt and water and all the things. There's the understanding of the pathophys really isn't well understood. There's some risk factors that we know. For instance, like I said before, women of childbearing age, somewhere between 16 and 30 is the range. Pathophys wise, or like other risk factors, history of autoimmune disease, um, history of like hypermobility syndromes. There's a lot of overlap between chronic fatigue syndrome and POTS, and there's a few other autoimmune type diagnoses that can either mirror POTS or overlap with POTS. And I think there's still some concern that there might be misdiagnosis for either in either direction. And so they're trying to tighten up the definition so that people aren't being overlooked, right? And being treated incorrectly. Some of the pathophys pieces is autonomic dysfunction. That seems to be a pretty high winner. Some sort of cause for the dysfunction is, like I said before, just like a high sympathetic drive. Something in the world of adrenal gland fatigue is put in the pathophys piece of it. The post-viral inflammatory piece seems to also play a component. There's still a lot of unknown, and it took me about 2 to 3 years before I started diving into the literature. If I could go back, I probably would have dove in more and sooner, but I was, like, kind of afraid to lean into kind of amping up my own, symptoms, right? Like, you read it, you're like, "Oh, crap, I have that," and then you start to freak out. And, it's a weird place to be when you know a lot of the background information and, um, it's still happening to you, and you're like, How is this happening?" So that was kind of a little bit of a weird, you're a you're a cardiopulm resident with a cardiac problem that never really feels great. And then the frustration of being in the ED and the kind of lackadaisical approach, like, "Oh, she must have drank too much. Oh, she must just be eating inappropriately." Um, that kind of you're young and healthy, you're obviously just anxious, like, that very putting off of symptoms, even though, like, I clearly had something happening here. That was really frustrating, and I think that also plays into a part with my own treatment style, right? Like, just be careful how you approach your patients, um, where you're not sort of placing blame on the person, where you're actually listening. I have a lot of patients now actually with POTS. I have a lot of patients with orthostatic hypotension. And I just ask them, like, explain to me what you feel. They're like, you're not going to understand. I'm like, you're right. I probably won't, but use the words that you want to describe this as. Like, I'm not going to put words in your mouth because the number one way I could describe how I felt was I feel off. The room wasn't spinning, my vision wasn't blurry. Um, I would consider it lightheaded, but like my head wasn't floating. I literally felt like the blood was rushing to my feet and off, like just not right. And I still to this day can't put really good words to it. So I let my patients do that. Like, give me the words that you want to use. Like, describe it to me. Tell me when it happens. Tell me what makes it better. Let them be in the driver's seat of that. Validate it, right? Like, no offense. That validation or just that ability to put a name to the thing that was happening was very calming for me. Whether or not I should have fought to get more testing done, you know, it is what it is. But just having someone say, hey, you know what? You're not crazy. This is happening to you. Your heart rate response is abnormal. This is a thing, right? Let's give you some tools to fix it. And I think that's a really important piece of healthcare that's sometimes missing. And it's also something I teach my students quite a bit is don't lose that human piece because this patient is somebody else's somebody's mom, dad, grandmother, sister, daughter, whatever, right? And also remember that when people are in the place that they're not in the best place. You know, being in the acute care setting, you get lots of patients who are at their worst. And sometimes patients are anxious. Sometimes patients might seem, I don't want to say mean, but like short. You know what? They're probably scared. They're probably anxious. They're probably nervous of an outcome. Understand that. And I think that's the piece I want to leave you with. We'll dive a little bit more into POTS as we kind of move forward. I actually think I'm going to bring one of my colleagues and friends on to speak about her experience with dysautonomic dysfunction. And she has a different perspective than me. And we'll dive a little bit more. Maybe I'll do a little bit more posting on it this month on Instagram. And I will be presenting on POTS at CSM. I'm part of the pre-con conference. So I'll be diving more into the pathophys and symptomatology and all that at that time. But just keep in mind that heart rate response to change in posture is not super normal when it's greater than 30 beats per minute. One caveat to that, excuse me, is for patients who are younger, between 16 and 19 years old, they actually increase the definition to greater than 40 beats per minute. Yes, there is compensatory increase in heart rate with change in position. That's how you don't pass out every single time you stand up. But the extreme, greater than 30, is where that definition cutoff starts to happen, combined with the symptoms and ruling out other issues, right? That I think is a piece that we didn't really touch on, but like ruling out other issues is part of the diagnosis of POTS. And I think that's why it's still not well understood and why it's still not, top of the list of diagnoses, but it is becoming more apparent. I've had at least 5 patients in the past 6 months with POTS. And that's something I've truly haven't seen much of in the acute care setting until now. So I think people are getting more familiar with the diagnosis. And I think long COVID has sort of pushed that as well. The other thing, just before I kind of send off with this one, that almost every one of my POTS patients have said to me is, it took blank months before somebody would listen to me. I felt crazy. I was told that I was anxious and just stressed. I had one patient actually sent to a psychiatric facility, and it wasn't until her symptoms got even more medically complicated and found someone who knew what POTS was that she started to actually make improvement. And the one thing I want to kind of pull back on here is that there's nothing wrong with anxiety and depression as a diagnosis. There are many people with anxiety and depression, people in my own family with anxiety and depression. But the piece of it is when it's the first choice in a medical situation where it's frustrating. And it's very common with females where you'll hear that. So that's personal experience. And I've seen a number of other patients have the same type of experience. So again, it could be anxiety, and it could be depression, and it could be panic attacks, 100%. But it's also important to recognize that there are other causes of increase in heart rate and palpitations. Having that rule out system, having the cause and effect, what makes it worse, what makes it better, is a really big piece of all of that. And I'm going to say one more time, there is a lot of physiologic changes that can happen with stress, anxiety, and depression. Fact. And if that is the cause, then it is important to treat said anxiety, depression, and stress. But it's also important to look at the whole picture and not just put it on that and ignore what is exactly in front of you. And if you are a patient who you just feel like you're not being heard, I really recommend getting a second opinion, having someone else here, maybe running a different test, because you don't just want an answer that may not be correct. And that's a hard piece to navigate, because coming from someone who has a family member with a long history of depression, it is super important to treat and diagnose. And there is a ton of stereotype that still exists with it. So I understand that piece 100%. And I do think it needs to be part of the rule out piece. But especially for young females in their 20s who, might look physically fit. I've heard a number of times, you're young and healthy. And that may be true, but it also may not be. And it's really important to make sure that we are looking at the whole picture, and that we're listening to good history, and that we're asking good questions, because that is half the battle. If you ask the right questions, you typically get the right answers, and that leads to the next big piece. So if you're ever a patient and you're in the situation where you're like, they're not listening to me, I'm not being heard, or you're just feeling frustrated, don't be afraid to get a second opinion. That's my advice with this one. So just to wrap up my story with POTS, and a little bit just about POTS. POTS is Postural Orthostatic Tachycardia syndrome. I don't even know if I've said that this entire time, so you're welcome in the last minute of this recording. I don't have an outline. I'm literally just talking to you, and so I'm hoping this is tracking in some way, shape, or form. So POTS is defined as an increase in heart rate by at least 30 beats per minute from a supine to stand position within 10 minutes of time, without a corresponding drop in blood pressure. So no orthostatic hypotension. It is solely tachycardia driven. Symptoms typically include dizziness, fatigue, palpitations, chest pain, post-exertional malaise, temperature regulation issues. And that is one piece I didn't talk about. Heat was a big issue for me. Excessive heat did not make me feel good for a few seasons. And I'm someone that typically likes summer. I like being hot. And as soon as I was outside in hot temps, my heart rate was like sky high. And I was like, nope, gotta go in. And like sucking down water and Gatorade. Non-pharmacologic treatment for POTS typically includes things like increasing hydration, salt intake, compression socks, and exercise. We'll go into maybe a little bit more of the pathophys and like actual numbers for all of those things at another time. There are meds that can help treat POTS. They're actually similar to what they use to treat orthostatic hypotension. So the two primary medications are midodrine and fludrocortisone. And they work a little bit differently, but fludrocortisone increases intravascular volume to help sustain that cardiac output and blood pressure. And midodrine is basically a vasoconstrictor that actually helps increase blood pressure by constricting vessels. So possibilities on treatment on that front. But exercise is also a big piece of that, including strengthening exercises and aerobic training. And you can start in whatever position the person can tolerate. And that's the big piece of that. POTS is still not well understood. I think a lot more research is going into it now due to COVID. Pathophys is still not understood. I recently actually read an article where there's concern that we're kind of now overusing the diagnosis, and I can sort of see that too when you don't understand the underlying cause, right? If the underlying cause is different, but the outcome is still increase in heart rate. The definition is what seems to be holding POTS to be POTS. But patients don't feel great. It's super scary. And, if you do have someone with POTS, help them validate that, right? Help guide them on how they can improve their symptoms. And I think we're going to do another episode on getting a little bit more into the details there, because I've already talked for about 57 minutes at this point about my experience. So we'll throw POTS back on the list. Maybe not this month, but definitely in the near future. So if you have any questions, if you have patients with POTS and you're not sure how to handle, I offer one-on-one mentoring for that kind of thing, right? If you have a complex case and you need some information or intervention techniques, or just kind of someone to talk it through, I'm here for it. So go to my website at allthingscardiopulm.com and you can sign up for a one-to-one mentoring session with me. If you are someone who is experiencing POTS and you need some help progressing, or you want to know more about non-pharmacologic techniques or what have you, I do virtual coaching. So you can go to my website and sign up for a virtual coaching session. If you are treating these patients and you just want more information, you want more help with that, please reach out to me. If you have any questions, reach out to me on Instagram or on the DMs. I'm also on LinkedIn, Twitter, all the places. So wherever you are, come and find me. My handles are in the show notes. And if you enjoyed what you're listening to, please drop a review. Please drop some stars. It is super helpful to know if I'm hitting home with these things, or if you have any topics that you want me to touch on. Again, shoot me a text, a DM, an email, all of the places, wherever you can reach me, I am available. All right. I think that's all for me today. I hope you all have a wonderful day, and whatever you have to do, get after it.